believed in my dream of setting up an organization called Restore, which supports refugee nurses, midwives, and healthcare professionals who have arrived in England as a forcibly displaced or a refugee, again through no fault of their own, but are highly qualified from their own home countries, and trying to make the most of their lives in the host country, and that's trying to get their identity back. It's a very difficult journey, and I have seen that firsthand from my own experience as well as my patients where I work. So as a result, we set up the organization, which now has supported 45 refugee nurses in England. So that's a nutshell of what I do on my daily basis. I'm a mom of 2 wonderful boys and a wife, of course.
Wow. Okay. So there's a lot in that, isn't there? There's a lot in that you say. I'm going to go straight into some serious questions.
Yes.
Okay. Through your health inequalities work, there are 2 people that you work with. One is professionals,
Yes.
yeah, and also members of the public,
Yes. Which are my patients.
which are your patients. And so, from what you've said, you may be often working with people who struggle
Yes.
to access healthcare.
Yes.
Now, based on your experience, what stops people from different communities going for health checks, for example?
So in my role as an advanced nurse practitioner in the north of Sheffield, which is unfortunately one of the areas that has probably is not as affluential, and people struggle more. So working in the north of Sheffield, I see patients who struggle to access equal care. My whole ether in my life is that every single person deserves an equal care, but unfortunately they don't all get it. So the main reason why members of different communities struggle to access this equal care I'm talking about, one is the lack of knowledge of navigating the system. NHS is wonderful, but it can be quite overwhelming to navigate for somebody who may come from communities that are already struggling. We call them health inclusion groups, so patients from these groups do struggle. That's the lack of is the health literacy, being able to understand the letters that are sent from hospital, being able to recognize the importance of screening, of health screening, being able to understand the advice that the nurse or a doctor gives you, whether it's in hospital or a GP practice. Other causes of those patients struggling is sometimes fear of unknown, fear of what the doctor is going to give me the diagnosis on, as well as especially for patients who have arrived as an asylum seeker, is their fear of health authorities, because trauma is hidden, and some of our patients have had trauma in their home countries from the health services they have attended. So that prevents them, because it takes a long time for somebody to start trusting again that the doctor in England is not going to be the same doctor as our patient may have seen in Sudan.
Right, okay, so there's a lot of things that you said in there. One of the key things that I've picked up is that, yes, there are health inequalities, and there are sort of lots of reasons for that.
Yes.
And you mentioned the NHS, and the NHS is a wonderful organisation. So, I mean, I believe that. It's there really to help,
Yes.
not to hinder. But often I come across that there is another sort of obstacle before people even come to our door, as in a service provider. So some of those issues, and you mentioned one is fear, isn't it?
Yes.
Yeah, fear of the unknown.
Yes.
Yeah, fear of what's going to happen.
Yes.
You mentioned screening programs, and depending on your sort of potential knowledge around and your health literacy, if you've been healthy so far and all of a sudden you get a letter through the post inviting you for a lung cancer screening or a bowel cancer kit, yeah, or a letter for a cervical smear or something like that, the first thing that goes through your mind possibly is that I'm getting this because I've got cancer. Have you come across something like that in your work, and what have you done in terms of putting those people's minds at rest?
Well, first of all, when in the current climate that we are living on, our patients often struggle with priorities. So with the increased cost of living, when somebody has to have multiple jobs to survive the end of month, receiving a letter that says you're invited to bowel screening, that's not their priority.
No.
Their priority is how can I survive the end of the month to feed my family. So that's our biggest non-attendance or even non-responding to our invites for bowel screening, breast screening, cervical smears. That one. Secondly, there is absolutely depending on your culture too. So some cultures receiving bowel screening is a taboo, talking about that part of the body, and
yes.
that's one of the patients that I remember talking. He was in his late 50s and he received the bowel screening, and he said, this is not for me. I am healthy, and we don't talk about this, especially with the female clinicians. So I could see he wanted to know more. He just wasn't comfortable talking to me. And of course, in the NHS, we try our best to accommodate patients' needs as much as we can. So arranging an appointment to talk to somebody he felt more comfortable with made that patient did attend the bowel screening, brought the kits. So there are many reasons why people do not view the screening, health screening as important, but I cannot stress enough how important it is. You may still feel you are young, but that screening can detect a condition that will save your life and will give you many more healthier life if it is detected on time. So please, to all the viewers who do receive screening letters at home, don't ignore it. Try to make it possible to attend, especially to my female gender patients. If you do receive breast screening, please do attend it. It is vital. It prevents, it improves your life if it is caught on time.
That's very true, and I think one of the key things about screening programs is not that you have cancer or may have cancer. We know through research that a certain group of people, may within certain age groups, it may be more common. And this is just a test to check to make sure that you're healthy.
Yes.
So it's not necessary. We have to somehow flip the conversation, don't we?
Yes.
An invitation for a cancer screening program is not that you have cancer, it's that to make sure that you are healthy.
And to make sure you don't have cancer.
And make sure that you don't have cancer.
Yeah.
And then the next step is that if, unfortunately, you are one of that small percentage
Yes.
that may have something, and if it's detected early, there is so much that we can do.
Yes.
You know, and as you said rightly, Blerta, that it's about how can we help you
Yes.
to live many more
Healthier.
healthier
Yes.
years, yeah. And because and this is something, I mean, I've mentioned this on the program many times, that 30 years ago we would not even say the word cancer, would we?
Yeah.
We would say the C word.
Yes.
Now, in 30 years, technology, science, treatments, cures, early detection, all of these has improved so much that a lot of the common cancers, like lung cancer, breast cancer, bowel cancer, cervical cancer, prostate cancer, if we can detect them early, the success rates and survival rates for treating and curing are hugely impressive, aren't they?
Absolutely, absolutely. Better than they have ever been.
Better than they have been, yeah, which is really good. So I want to delve a little bit deeper into cultures and beliefs, because, you know, across cultures and traditions and values and beliefs and religions, there are certain specific ways, systems that people have, don't they? And they vary so much in terms of help-seeking behaviour. Yeah, when they actually go to, who they talk to. You talked earlier about a part of the body that we don't talk about with the gentleman with the bowel cancer. So, have you got another sort of something that you can share with us about someone's cultural beliefs, which made them nervous or afraid of getting a health screening program or treatment or attending it? I know you mentioned the gentleman with the bowel. Have you got something else?
I think I will mainly talk in general. So there are patients, and one of the parts of treatment or prevention that worries me the most as a clinician is mental health. Mental health and trauma are the hardest subject for our patients to talk about, especially coming from ethnic minorities, coming from different cultures where in some cultures men don't talk about mental health, or even ladies don't talk about mental health because it's taboo certainly in some certain culture. Talking about mental health is absolutely very strict, and you only they try to hide it as much as they can. And my advice, one particular group of patients that I worry about is, yes, men and postnatal women, so ladies who have just had a baby. We all know that when you have a baby, your hormones change, your emotional health changes as a result of having a baby, and all the due to physiological changes with hormones. And there is a little bit of a condition called baby's blue. So that's okay if you just have a little cry, one-off, because you are just too overwhelmed of looking after a baby. But if you do find that this is becoming recurrent, if you find that you are too overwhelmed and you cannot cope, please do seek help. Come and see your GP. Come and see your clinicians in a GP practice. We can refer you to where the help is needed. And if you notice that you have the symptoms of low self-esteem, you are irritable, you are very tearful during the pregnancy, talk to your midwife. Is so important. So for all the ladies out there who have just had a baby and are feeling having the symptoms I am describing, please seek help. There are loads of baby and mom's group where the person who leads the group may be able to talk to you, and if that person notices that you're not feeling quite well, it's okay, talk to her, because that person will be able to signpost you to where the help is needed. So these are the ladies who have just had a baby. And then for men, oh please do seek help when everything is too much for you. Seek help before everything becomes too much for you, because that's why we are there for you. We are there to help you if work is too stressful, life at home is too hard, and you just can't cope. When all of the symptoms start to affect your work, your daily life, there is help. There is help. We have psychological therapy in community. We have medications which are usually second line. We start with talking first. So please come to seek help before the symptoms become too severe. And nobody will judge you, nobody will blame you. The care, that primary care, which is GP practices offer, is the first step on you getting the support.
Thank you so much for that. And I reiterate that message. The first point of call is always your GP.
Yes.
That's the first place to go, because that's your access point.
Yes.
And they will then be able to refer you.
Yes.
But I've also come across people who say that we can't get an appointment, and there's all those kinds of issues. Yes. But the other thing that I say is that there is always someone somewhere that you can talk to.
Oh, there are so much.
Even if it's your next door neighbour, even if it's your best friend, even if it's a work colleague.
There are
you
so
need
many
to share.
charities that
Yes.
are completely confidential. If you can't get through to your GP and you still need
Yeah.
help, ring mine.
Yes,
Ring other charities
there are so many.
that you can pick up the phone. It's completely confidential. Talk to them,
Yes,
and they will be able to direct you and
Yes.
help you. But don't bottle your feelings on your own and then becoming too much.
yes. Thank you so much for that. You train doctors and nurses about working with different communities. What's the most important thing that they need to know?
So I have now been training, I started with training university students, both at Sheffield and at School of Nursing and School of Medicine at University of Sheffield. And in the last 3-4 years now, me and Dr. Kemp, who unfortunately can't be here today, we started the role as a health inequality tutors, educators for all primary care clinicians. And when I say that, I mean everybody who works in GP practices and community. Our aim is to increase the awareness of health inequalities. Despite of how hard clinicians try, unfortunately, in 21st centuries, there are still patients who are struggling. So we bring this health inequalities umbrella into the healthcare professionals' awareness, again, to say, please, if you do have patients from health inclusion groups, if you have patients who struggle to make an appointment, it's very important that we don't exacerbate this by ignoring them, by dismissing their symptoms, because for me, cultural humility is very important. As a doctor and as a nurse, it's very important to take into consideration patients as a whole, not as a disease. Patients as a whole person, by including their psychosocial well-being as well as the disease. I know we are very busy in a 10 minutes consultation, but showing empathy, understanding, and compassion doesn't take you very long. Understanding family concerns when a patient comes with family members who are very worried about their child or their partners. Understanding that people of different culture present symptoms slightly different, and that could be because of their own experience, or it could be because they are not all articulate how to present the symptoms. So understanding patients' background is very important.
Well, thank you so much for that. We are coming up to a short break soon, but I think we've got about a minute or so. I just want to have... when we come back, we'll talk about the Restore programme.
Yes.
Yeah. And very quickly, very briefly, why does it matter to have nurses and doctors from different backgrounds when we're talking about healthcare?
Is very important because these nurses bring their unique skills and talents and expertise in a different way, which enhances patients' care, not just from the diverse community, but every patient that comes into their care.
Thank you so much for that. We are going into a short break and we'll be back soon. Hello, welcome back to Care Across Cultures with me, your host Mirban Hussain. We've been talking to the wonderful Blerta Ilazi. Her job title is Health Inequalities Educator, but listening to what she's been talking about, there's lots and lots of wonderful things that she also does. I've certainly learnt a lot. So, Blerta, I want to talk to you about now, some people don't trust the healthcare system. And we've talked about many of the reasons people don't trust. It may be of previous experiences in this country or from another country. How can hospitals and clinics earn that trust back?
Thank you. Trust is something that takes time to be built. Trust, especially if it has been broken before. So, NHS, as wonderful as it is, it still needs continuous improvement in order to meet everyone needs. And when we talk about NHS, we know the basis of why it was found, don't we? So it was found to meet everyone's needs, regardless of whether you are able to pay, and is based on your clinical needs. However, after all these years, we still have patients who may not be able to have their needs met. So I think we need to do more. And what NHS organizations need to do is work much closely with communities. Work with community centers, community leaders, faith groups, the community organizations that hold that trust in general public. And sometimes I know, and that's one thing that is great to see, is how we have changed, especially post-COVID, how there are so many GP practices that have gone out of their bubble of seeing everybody in a GP practice to actually going to where patient is. So an example of this is being able to reach so many of these vulnerable patients. So instead of waiting for a patient to come for annual review check, why not go to the place where this patient would be there, where you are able to find them. Apologies.
That's okay.
So trust can be built by working together. I am a very strong, passionate advocate for my patients, who I call patients who haven't got a voice, because most of my patients are not confident to speak for themselves. So if NHS work much closely and much better with communities, we can reach more people. And that's where the trust can be gained back and can be better. Yeah.
Right, thank you. So, there is something that you're quite passionate about as well, isn't there, within health? And I think it links in really well with what we've been talking about. We've talked about screening programs which can identify illnesses. What about the other side of screening programs, prevention, vaccinations?
Absolutely.
Tell me a little bit more about this passion you have for vaccinations, and why should people get vaccinated?
There is a lot of work that is being tried to do in community to increase the vaccine uptake. And I think the reason why I'm so passionate is because the health literacy amongst those parents who refuse to have the vaccine for their children is, we understand children can't make decisions for themselves, but the way that our technology has gone, and how can in NHS we can educate these parents to have the right information for the vaccination, because by not having the vaccine, the risks of these children catching infection and illness that could have been prevented if the vaccine was given during their childhood. So it's very important for you parents out there to trust the medical evidence that has shown that vaccinations are safe and have been safe years and years, and every other health literature out there that says otherwise, please just read where it comes from. Read who has written. We can't control what people put on internet, but we can control what we want to take from them. And if your health professional is giving you the best advice regarding the vaccination for your children, then trust them, because to be a doctor, to be a nurse, to be any other healthcare professionals, they have studied not just the undergraduate degree, but they have specialized and they have the knowledge that is safe. So please do consider vaccination as not a luxury, but as a right that every child should have. And for our colleagues who work in those areas that parents are refusing vaccination, let's do more. Let's start with reaching these communities. Let's go to play groups. Let's go to this community center where we can reach, or even schools before they drop off children. Arrange a coffee morning with the school. Let's work together so we can give them the tools they need to make the decision for their children's health.
Thank you so much for that. That's a passionate plea. I think what I'd like you to talk about now is give our listeners an example of a vaccination program that has worked and all the benefits of it. Anything that you can think of.
Yes, well, every vaccination that we have in the childhood immunization schedule, they have all prevented conditions that, unfortunately, for people who have not had the vaccines, or let's talk about measles.
Let's talk about measles, yes.
So we know that we have had recent measles cases.
Yes.
And unfortunately, if the first child who had the measles had been vaccinated, there wouldn't be a measles. And then it was spread because there are so many unvaccinated. I don't have them exact number of statistics,
No.
but just from what I see, what I hear in my role and in the community, the hesitancy of those parents vaccinating their children has just gone absolutely incredibly concerning, especially post-COVID. And viewers need to remember COVID was a different. COVID was a condition that nobody was expecting, and it has nothing to do with the vaccines of the childhood immunization.
No. So, is it possible that some of the reasons for people not vaccinating are the same as some of the reasons that we spoke earlier about accessing healthcare in general?
I think most reasons are parents possibly not having access to the or having access to the information, but choosing to believe those, shall we call them conspiracy health, those people.
Or, let's call it other information that's out there.
Yes.
Okay, rather
yes.
than conspiracy.
Unconventional.
Yeah,
Yes.
yeah. What would you? I mean, you've already said, but what can healthcare professionals, what can the NHS potentially do more of in terms of vaccinations?
I mentioned earlier, for example, in Sheffield, we are very lucky that we have a group of healthcare professionals with same passion as me, working in the north of Sheffield, which part of their role is educating around or increasing the uptake of vaccination. I think this is the job that needs the close working relationship with communities. So the key ingredients of increasing uptake to vaccination, increasing uptake to health screening is being able to reach those communities where they are.
Mm-hmm.
Because we do see them in GP practice, we see them in hospital, but we see them too late when they already have a condition.
When they've already got it.
Yes.
Do you know of any programs or any sort of specific organisations that is doing something at the moment? It might be across the country somewhere that we can take some, we can copy maybe.
Yeah, but the group that I was talking about is, I think there are small groups of healthcare professionals doing that, probably individually working with. I can't think of any large organization that is doing anything we can copy, but there are so much out there.
Okay, so here's a thought. You mentioned earlier about the role of community groups, faith leaders, community leaders, working within, and these are people who have a trust.
Yes.
They have reach,
Yes.
and they may also have a history of working with community
Yes.
groups. Is that not potentially a way for these kinds of programs to work with them? Because you suggested that earlier, didn't you?
Oh, absolutely.
Yeah,
I am
yeah.
again. I feel very strongly about NHS working together
Yeah.
with community groups, community leaders. We had fantastic examples throughout the country during COVID, when COVID vaccines were delivered in the mosque or the church. And now that theme has continued, and this is the hope that I have for the future, is that things are improving. We have a GP practice that goes to a men's club, or GP practice that specializes on looking after the homeless patients, who goes to the, for example, in Sheffield, in the Archer Project, which is a center where patients receive care, and if healthcare professional can manage to go there, that's where they meet the most vulnerable patients, which will be homeless patients who may not otherwise not come to see you at the GP practice. dress their wound or looking after their mental health.
Oh, tell me a little bit more about the Archer project, because that's in Sheffield, isn't it?
Yes, and there are so many projects like Archer project around the country that you can think of. Rotherham is Shallow. Another
Shiloh works
yes.
with the homeless, yeah.
Yes, so similar projects all around the country, and I think they are working very well with a part of primary care called health inclusion
Yes.
care, which look after those patients particularly. And it just works wonderful because you are there to see your probation officer, you are there to see your rehabilitation healthcare professional, and you can see your GP, you can see your practice nurse who will check your wound. So having them in one place is the ideal world.
It's actually about going out to the people.
Yes.
You said this earlier, didn't
Yes.
you? Yes, we have the NHS, which is an amazing and wonderful organisation.
Yes.
Then we have GP surgeries who have their own specific areas, but you're talking about actually going to the people, because if they're not coming to us,
Yes, we are missing them.
and then they do come to us when it's very late in the process, isn't it?
Yes,
When
absolutely.
there's nothing that we can do for them potentially,
Yes,
or very little we can do to them. But you're talking about something
which is happening.
which is happening.
Yes, which
Yeah.
is hopeful and promising that it is happening now with a new way that NHS would like to work, as called neighbourhood localities.
So is this part of the
Yes.
new NHS
well, it
10-year
has been
plan?
happening before. The
Right.
name just changed.
As the name just changed,
Yes.
okay. Right, okay. So thank you so much for that. What makes you feel hopeful?
All the changes that I just mentioned,
Yes.
considering that there are, and this is what I say this all the time, NHS survive because it has some wonderful staff working.
Yeah.
There are some absolutely excellent doctors, nurses, allied healthcare professionals, managers who have the patient as their center of their role, and things are improving, and there is better communication now with communities, better working relationship. We now know that for patients who have communication challenges, the service exists for them to be able to access that healthcare. There is interpreting service for patients who are unable to speak English or BLS interpreting. So these are all the changes, and of course with advanced technology, medicine, the life expectancy increases for those who access the right care. However, this is the painful bit. Despite of all the access technology, there are still patients whose life expectancy, unfortunately, is decreasing. And these are patients from health inclusion groups, which we need to do more. We need to do more.
Right, thank you so much for that. Thank you so much.
I didn't want to end it in a...
No, we're not going to end it there. We're not going to end it there. I think the thing is that, I mean, you're so right. And your passion and emotion comes out in that, because what you're talking about is that there is help.
Yes.
The organisations, the NHS, healthcare profession, there is lots and lots of support that we can provide to help make your life better
Yes.
in terms of your healthier,
Yes.
yeah, in terms of your any illness or disease that you have, yeah, and some of these are life-limiting diseases, which and some of these are terminal.
Yes.
So you've got this. There may not be a cure sometimes,
Yes.
but they are treatable, and we can improve your quality of life, and that's the passion that's coming out. just because we can't cure it does not mean that we cannot make your life and add value to your life.
Yes.
Yeah,
And
make the pain go away.
absolutely, and it's just so important that some people out there that we are improving so much more the end of life.
If you've just joined us, you are listening to Care Across Culture with me, your host Mirban Hussain. I've been talking to the amazing, the wonderful, and the very passionate Blerta Ilazi, who has been sharing some of her journey with health inclusion groups and health inequalities. I hope that you can take something away from what she said. Here are some of the key things that she talked about. First point of call is always your GP. That's where you need to go. If you have issues, there are lots and lots of organisations, charities that you can reach out to, and it's completely confidential, who can help support you. She talked a lot about prevention and vaccinations, especially for children, but not just for children, and why it's so important that you do get these vaccinations done. If you don't understand, approach a healthcare professional. They'll help you understand. The whys. Ask those questions. And they will put your mind at rest, and they will be able to explain so that you understand. What I'm wanting to do now is I'm going to ask Blerta one final question. What, Blerta, would you like our listeners to take away from our conversation today? It can be one thing, it can be two things. You tell me.
Again, thank you very much for giving me this opportunity to share my passion with the viewers, which of course are very strong, and I do this because I have the experience of seeing the consequences when people don't have the information they need to make the right health choice for their life. So my takeaway from today is, if you could remember at least one thing: your health matters. If you do need help, there is so much out there for you to access the help you need. Prevention saves lives. So especially for parents, vaccines of your childhood immunization are so important. Please do talk to your GP after listening to me. If you want to know more information, the practice nurse are there. And remember, NHS is there to care for everyone, regardless of the background. The more we talk about openly about our health, the more we break this stigma and break down the fear for the next generation. Thank you very much for that.
Blerta, thank you so much for sharing all of your passion and your knowledge. This is Care Across Cultures. This is the end of the programme. We will be back next week with another wonderful guest and another programme. Allah Hafiz.